Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm here with Rachel Blank, the founder and CEO at Allara. How are you today?
Hey, I'm good. How are you? Thanks so much for having me.
Absolutely. I'm excited for us to get rolling. I was talking to you a little bit before we started recording. We like to keep these short and sweet, so we will for our audience, but wanted to kind of talk more about your background quickly. So if you give us the quick intro, and then if you could tie that in as you're talking about yourself to the why, how, what of Allara, that'll be much appreciated.
Sure. So I'm Rachel Blank. I'm the founder and CEO of Allara. Allara is a specialty care platform in the women's health space. So we built a collaborative care platform to treat women with chronic reproductive conditions. We're starting with a care program for women with polycystic ovary syndrome, or PCOS, which affects about 1 in 10 women in the US. Allara actually was built a lot out of my own personal experience. I was diagnosed with PCOS about 10 years ago and really had never felt like I got the care that I needed. I felt like I was constantly running down different doctors, doing my own research. All of the care felt very fragmented. And it also felt like I was kind of starting over every time I saw a new provider. So every time I moved and saw a new gynecologist, I was, all from the beginning, explaining myself, trying to almost prove that I had this condition. And it just got to a point where it's really frustrating that I couldn't get all of the care that I needed in one place. And so Allara really was built out of that personal frustration and out of seeing that, we really needed a place for if you were struggling with a chronic condition, you needed a place where you could have ongoing care and also care across different modalities. So not just GYN care, but also care on the nutrition and lifestyle side, care on the mental health side, really bringing everything together in one place. Professionally, I had been in digital health for a few years. I was an early employee at a different digital health company, and so was able to merge that personal and professional experience together. And, really what we are building with Allara, if you think about it, is really being that specialty care layer that doesn't really exist in women's health today. So in women's health today, if you have care needs that go beyond just that annual GYN visit, there isn't really a place for you to go. And that is kind of that resource that we were trying to build at Allara.
Yeah, though, thank you for the intro. And I think the best companies kind of come from someone's personal experiences. So I'm sure that helped. You didn't have to go and absolutely, obviously you had to do your research, but you were the research too, right? Like what you went through. So I always love when founders have stories that kind of tie back to why they started the company. And those are the companies that will succeed. Whenever it's just about I heard about this idea and I learned and I'll go from there. Those companies don't tend to do as well. So super interesting story that you were able to provide. What I want to talk a little bit about is, so we've had a ton of women's health companies come on the podcast, right? Anywhere from Genève in the menopause space to Pandia Health, which is also kind of in that women's health bundle, and Electra Health as of recently. So, I feel like a lot of people lump a lot of different companies into the women's health category. Talk a little bit about why that's wrong to do that. And then also, I would put Allara obviously in women's health, but how is Allara different than a lot of these other companies in the women's health bundle?
Yeah, that's a great question. So taking a step back, women spend about $500 billion a year on healthcare expenses. Women also tend to be the decision maker in about 80% of healthcare decisions. So when we talk about women's health, I think a lot of times we just think pregnancy, either trying not to get pregnant, trying to get pregnant, or managing a healthy pregnancy, when in reality, women have so many needs that actually are different than men because of their reproductive systems, but aren't necessarily related to pregnancy. And so I think a lot of times there's this misconception of, well, it's just all of these pregnancy businesses and that's it. And really what we're focusing on is how do we treat this kind of whole person care, but treat them in a way that is reflective of the fact that they have different biological needs. So again, a perfect example is as we think about like our platform, that is treating what we call specialty care in the women's health space. So we're treating conditions that only affect women, conditions like polycystic ovary syndrome, which again are related to a female's reproductive system, but don't just affect your ability to reproduce. Comorbidities that we see with PCOS include prediabetes, diabetes, high cholesterol, obesity, infertility, mental health disorders. So it really is impacting your entire life and your entire set of healthcare outcomes, but is not even that related to pregnancy. And I think when all we think about is, well, women's health is related to pregnancy or conception, we missed so much of what makes women's healthcare different, and what actually we need to start thinking about as we think about healthier outcomes for women. A perfect example that people give a lot is heart attacks actually present differently in men and in women. And if you're a woman who goes into the ER with a heart attack, you're actually more likely to die. And you're even more likely to die if you have a male doctor over a female doctor. And again, it's kind of getting rid of these nuances and not having the nuances of care, where we really have subpar healthcare outcomes for women.
Yeah, thank you for the breakdown. And it's that I always found that stat interesting about the 80% of women make the household decisions. But then I thought back, like in my, not like, you would never think it's like that much. And then I thought back, I'm like, I don't ever remember my father ever making a healthcare decision for me growing up. And it's definitely interesting though, that it's like that much of so it makes sense, right, to continue providing lots of different care options for women, and also ultra focus, like you were talking about too, because it's not just that you have to look out for yourself. There's usually children involved. There's a spouse, right? So now it's that's right. A lot of burden if you have to keep bouncing around to all these different healthcare options and worry about yourself. You have to worry about yourself. I'm trying not to say anything because I'm not trying to say I can't believe women make 8, because that is not what I'm trying to say here. But yeah, you're that was interesting, a breakdown kind of the women's health space. Can you talk us through, because like I said, we keep these short and sweet, and the goal would be to have you on again soon, and we can kind of dive into some other issues, and maybe we also have some of the other founders in the women's health space come on and kind of talk about the different areas that you're all addressing.
Yeah, that'd be awesome.
Yeah, we'll have we could have Alessandra from Electra Health on and stuff like that and talk through some stuff. That'd be fun. But in terms of, can you just talk us through kind of what's next for Allara from here?
Yeah, so something that's really on our roadmap for 2022 is expanding access to the program and thinking about how do we get this program into the hands of as many women who need it as possible? And we're doing that in 2 big ways. One is just expanding state coverage. So we're live in 14 states right now. Our goal is to be live in all 50 by the end of 2022, and also expanding insurance coverage. So right now we are all direct to consumer, and we are all cash pay for our services, but we are working on going in network with insurers as quickly as possible so that more women can afford and benefit from the service. I think a lot of that case we have to make is just like we were talking about before. Unfortunately, we really have to make the case of why, in a lot of cases, women's healthcare is important and why insurers should be spending on more than just healthy pregnancy outcomes. And that's something that we're really trying to build awareness around next year.
Yeah, it's not fun, right? Where you also, you have to get in network with these providers to continue that extra layer of support for your patients, but it's never fun when you have to also make a case, right? For some of this, like you were saying about why they should be spending this on, spending X on this service. Really interesting.
Right.
I was interested in what you were building from the first minute we spoke. Super exciting. I can't remember. Was it, we had a similar, was it Tina from,
yes.
Yeah, Tina from 7 Star.
Yes, a mutual friend. Yes.
Yeah. Yeah. I mean, we have her on too. We talk about. We'll get a crew on. That'd be fun.
Yeah, we can have the full life stages: PCOS, pregnancy, menopause. The full life. That
would be cool, actually. Yeah, we'll just go down the line. I haven't used this for multiple people yet, but I'm sure it'd be a ton of fun to have all the different screens going. Each person kind of gets their moment. That'd be fun. We should set that up. Let's do that in Q1 for sure.
Would love that.
Awesome. Well, Rachel, thank you so much for your time today. I'm excited to spread the word about Allara with our listeners and continue covering now the company now that we have this initial intro episode for you. And can't wait to have you on again real soon. So thanks so much.
So, thank you so much. Thanks so much for having me.